Hello, my name is Selena. This is my presentation for Myra. Myra's case study analysis, family, social, and community support, SWK 290, Selena Mitchell, Grand Canyon University. Myra is a 28-year-old biracial woman, Black and Native American, lives in a rural southwestern town, and works as a healthcare clinical receptionist, pursuing her GED, seeking help for anxiety, depression, and low self-worth. Myra's family dynamics: father struggled with alcoholism, emotional abuse from father, mother emotionally unavailable, close but strained sibling relationships, childhood marked by instability. How family support helps or hinders recovery. Potential benefits: emotional support from siblings, shared understanding of childhood experiences, and opportunity for healing relationship. Potential challenges: unresolved trauma, distress of counseling, ongoing family stress. Social support network: friends and work colleagues. Coworkers encourages GED completion, previously socialized regularly. Many friends now work remotely and increased social insulation. Impact of social networks: positive effects, encouragement and motivation, sense of belonging, emotional support. Negative effects: increased reliance on social media, comparison to successful peers, and increased anxiety and depression. Community support: community resources, healthcare, clinic employment, telehealth opportunities, community outreach programs, religious community connections. Barriers: rural location, mental health resources, and limited access to healthy food. Social work advocacy: the NASW Code of Ethics, service, social justice, dignity and worth of the person, importance of human relationships, competence, social workers' role, strengths based approach, cultural responsiveness, clinic self determination and resource connection, evidence based interventions, cognitive behavioral therapy, mindfulness based stress reduction, strength based practice, and telehealth counseling with support groups. Community stakeholder collaboration. Example one: healthcare and social workers and community agencies expand the mental health access. Example two: schools, employers, and GED programs support adult learners. Example three: local government, nonprofit businesses, which would improve healthy food access and address social determinants of health. My conclusion: key takeaways. Family influences recovery positively and negatively. Social support reduces insulation. Community resources improve outcomes. Advocacy empowers clients, and collaboration strengthens communities. And then here are my references. And then overall, from the top, Myra's recovery is influenced by many factors, including her relationships with family members. Family support can be a significant protective factor because healthy relationships can provide emotional encouragement, stability, and practical assistance during difficult times. If Myra has family members who listen to her, respect her experiences, and support her goals, these relationships may improve her confidence and motivation during recovery. However, family dynamics could also create challenges if family members minimize her struggles and create additional stress or make decisions for her instead of allowing her to have independence. As Myra's social worker, it would be important to assess both the strengths and challenges within her family system while helping family members learn ways to provide supportive and empowering interactions. Some other keynotes would be: community support is another important part of Myra's recovery. Community resources such as church members, neighbors, healthcare providers, and community agencies can provide additional emotional and practical support. For example, community organizations may help Myra access counseling services, financial resources, transportation assistance, or other services that address barriers affecting her well being. However, community support could also become harmful if Myra experiences stigma, discrimination, or pressure from others. Social workers must advocate for inclusive communities where individuals feel respected and feel supported. As Myra's social worker, I would advocate for her well-being by following the NASW Code of Ethics while emphasizing the importance of service, social justice, dignity, and worth of the person. The importance of human relationships and competence. I would use a strengths-based approach by recognizing Maya's abilities and existing resources rather than focusing only on her challenges. I would also practice self determination by involving Myra in decisions about her goals and recovery plan. Evidence based practices show that collaborative approaches, strong relationships, and access to supportive resources improve outcomes for individuals experiencing challenges. My three examples of how community stakeholders could collaborate to promote human flourishing for clients like Myra could include: number one, healthcare providers, social workers, and community agencies that can work together to create coordinated care plans. Number two, schools, workplaces, and community organizations can collaborate to provide supportive environments. Employers and educational institutions can promote wellness by offering resources, accommodations, and programs that support individuals facing life challenges. And third, local nonprofits, government programs, and community members can work together to reduce barriers such as limited access to mental health services, transportation, housing, or financial assistance. When communities combine resources, individuals have a greater opportunity to heal and thrive. In my conclusion, Myra's recovery is influenced by the relationships and resources surrounding her. Strong family connections, supportive social networks, and accessible community resources can promote resilience and recovery. As social workers, we have a responsibility to advocate for individuals like Myra by respecting their dignity, empowering their voices, and connecting them with resources that support human flourishing.